We continue our series for the children, and joining us today is Drew Hayes to discuss how to tell if your child needs a counselor, and that's what you do, right?
Mm-hmm.
And so, I guess tell us first off, what are some things that you typically counsel for?
Mm-hmm. Well, at our clinic, we see all kinds of issues: anxiety, depression, attention problems, school issues, all kinds of different things.
And I guess depression, maybe, or anxiety, maybe two that I'd like to focus on really quick. Mm-hmm. In younger children, how do you? Is there a way you can catch that early? Mm-hmm. You know, maybe age 4 or 5. Is it possible for a child to be depressed? Mm-hmm. Then?
It is. Most often in that age, it'll be different than what it would be typically like an adult, because what you'll see is they'll be usually exhibiting more behavioral problems, more withdrawal, some crying spells. They can be sad, that kind of thing. And often what happens is it comes from some kind of adjustment, either a divorce, someone dies, moving, things like that. So that's usually where you see those things happen, is when there's an event that happens that changes in their life, and then they become either maybe not clinically depressed, but have an adjustment to the issue that happened.
Okay. Now I guess in maybe some signs that your child needs counseling for something that you may not be unaware of. What would some of those be?
Well, depending on the issue, it can be different for each thing. But the main thing is if there's problems going on that were not occurring before, and you're having problems being able to address it with whatever you've been doing. If it's a school problem, if you can't address it with tutoring, if you can't address it with talking with a teacher and doing extra homework, if it's anxiety, if you can't address it by trying to work with them and help them deal with problems. If there's something that's not being fixed and it's getting worse and it's causing problems for them, that's probably the biggest thing. If whatever the issue is, if it's causing impairment for them, if they can't function how they have been, that's when something needs to be looked at, just to see what's going on.
Okay, so obviously a big factor, I guess, for school-age kids is grades. You see a change in grades and then behavior. What are steps that you take at that point? Do you sit down and talk with them first and ask questions, or? Well,
we start with an intake and we get a whole history of what's been going on. This is very important because there can be lots of things that can contribute to grades, just specifically. You can have problems with sleep, you can have problems with nutrition, you can have problems, other health issues, you can have problems with like ADHD, depression, anxiety. All these different things can cause problems with grades or behavior. And so it's very important that we don't look at just what the symptoms are, just a certain thing. We looked at the whole history, the whole family, and the dynamics of what's going on so we can get an accurate idea of the problem.
Okay, so bottom line, how to know if your child needs a counselor, about 10 seconds left. You just look for behavior changes, right?
Yeah, if something's going on that's different and you're having a hard time addressing it and getting a hold of what's happening, it's best to try to seek help either with a pediatrician, talk with them first, or the counselor or whatever, and just try to figure out what's happening and what can we do to help the issue.
Excellent. Thanks for joining us today.
Thank you.
If you have any questions about our segments, you can email us at morning@WTVY.com. Also, if you'd like to watch this interview or past interviews, log on to the web channel, WTVY.com. Good.